Okay, so this is the 3D scan image from the cone beam that for the patient. Implant tooth number 26 and 27. As you can see from this cone beam, we can have the view of the panel. And with that, we'll be able to trace the nerve away. It's not really relevant for this case, and we're not doing a posterior teeth. However, the space between number 26 and 27 very narrow. So with this surgical guide, the surgery gonna become very helpful and handy in the way, because when you're looking right here, I'll be able to make sure I house the implants nicely in the bone, and then the access of the screw gonna be on the lingual of the future crown. You can see the red wax I created here, that for the future crown, and they're gonna be in perfect occlusion with upper number 7. And with that, for example, we're looking on tooth number 27 right now. I'm gonna move that. You can see how the implant being housed or immersed all the way inside of the bone. Now let's switch to tooth number 26. To verify that, you can see how 26 being buried all the way in the bone. Of course, the patient had a bone grafting. It's not very level. You can see the shadow here a bit lighter. So that makes sure when I do the surgery, I make sure that the implant go on the way down. Even below the bone is okay. So to make sure that no exposure in the future. And from this view, you can also see how the lower future crown and the upper being in occlusion. So that will make sure how long the implant gonna last. And with the 3D planning, it's very easy, comfortable for the patient as well as for the surgeon. So no sutures, and patient recovery is very friendly. Normally they have no pain the next day. So that is it. The plan is done. Now let's go do the surgery. So today we're going to do surgery implant for number 26 and 27. Patient had those teeth removed and he did have a bone grafting around 6 months ago. So today procedure very easy. We do guide the surgery, and for that reason the first thing I'm gonna do is try in the surgical guide. Make sure it fit perfectly, and you can see that how nicely it fit, engage in, so it go nowhere. That the problem is the surgery because the space very limited. And for that reason, when we use a cone beam to scan his bone, I'll be able to check out exactly how many millimeters that we have from each implant away from the teeth to be able to put those implants in. 6 months later, when it's ready to restore, I probably gonna have to smooth out the side of the other 2 teeth a little bit to get some room for the crowns to go in. But so far, it fit perfectly. How you doing, sir? Good? Mm-hmm. So now, we're gonna get the patient number. Since we do the guided surgery with the punching technique, so I don't have to flap the patient gum open. And that being said, patient not gonna have much bleeding at all, so you don't have to worry about being fainted. And I don't have to numb the patient a lot. First, I just put the surgical guide back in, make sure it still fit perfectly. The tissue that I just numbed won't get interfere with the guide. Now you can close to relax like that. So first step, we punch the tissue. We use the 3.5 diameter implant, so we use 3.5 punching size tissue. Alright, Jim, you're not supposed to feel anything, okay? Just a little pressure here and there, but if you feel any pain, you raise your left hand, I will stop. Alright? Now open up. Next is just a little pressure. Let's remove the guard. You can see the tooth something there. If you need a break, let me know, okay? So go back in right here. Make sure country stop all the way. As you can see right here, this way two small 3.5 diameter tissues I have to remove. Because the bone level is not very even, so the tissue is not even. That's why I have to go back in, hand free to punch the tissue earlier. Otherwise it should be very easy. And remove the tissue, all the tissue around have to be removed because otherwise going to interfere with the integration of the implant in the bone. Am I hurting you, Tim?
No.
So you can see the patient having very minimal bleeding, not much at all. How you guys doing, gentlemen?
Doing good.
Let me know if you need to sit down. Just kidding. You okay, sir? Make sure all around have to be nice and clear. Okay, I'll go back in with my guy. This one is called surgical sleeve. It fits perfectly. 1, 2, 3. 2.0, Monica?
Yes, 2.0.
Open big for me. Thank you. And go up and down. The release on the bone. How you doing? Good? And down. Open big again. Thank you. Now you can relax. You can see there a stopper on it. So go on the way. And because of stopper, I cannot go deeper than I planned or go with the wrong angulation. Everything is planned properly, so I expect the surgery going to turn out good as we planned. What I'm doing right now is just clean out the extra bone that we just removed. And during that process, if you see a little bit of the tissue hangover around like this, actually as a matter of fact, is some little bone or little root tip stuck in there. Now I'm able to remove it. irrigate again without salting water. You can see how it goes lower, but same technique up and down to release the pressure, also releasing some bone that's coming out from the tooling. Alright, one completely done. Let's finish up the second one. You okay, Jim?
Mm-hmm.
I have patients come to me and they have implant done, some other implant done before with the traditional technique. They're surprised how easy it is and friendly it is. Now we done with the drilling. How you doing? Good?
Okay, yeah.
Now you can close, you can swallow, whatever you want, but when we're ready to place the implant, try to stay open for me, okay? If you need any suction, let us know, but try not to close. I don't want to be contaminated. Okay, Tudor, you want to change hands? So you can come in and do it proper. So implant going to be placed in blood. So that can integrate really good with all the blood cell around there. So you just stay open like that for me. Implant going in. I'm ready. The implant come out in the pocket. So the surface, you can see the dark titanium surface, cannot be touched by any means. Run it out, straight into the socket. Open big for me. Thank you. As you can see here. No pressure. It's doing by itself. The same angulation that we planned. The cylinder, the help to be with a parallel if we need to. But now the implant is in, let's just remove it. The implant inside. Now second implant go in. Stay open, okay sir? You're doing great. You're almost done. They both 3.5. You can see I went in. I didn't even touch the adjacent teeth. But then make sure the implant surface cannot be touched by any means. Wait a little bit to release the pressure. So you go back and turn up again. Go to the next one. That's a 1, 2, 3. And then I go back to make sure, because we didn't flap the patient, so I make sure the implant emerges way below the bone. As I mentioned before, his bone is not level, so one side higher than the other one, so I have to make sure this side in the back all the way immersed. And then hold your finger on the top to get stability. So I can check and see. We're putting the bone here. We try at the bone level. Here's the shine from the focal and in the front of it. So I go back in, just come down a little bit more. It's getting tighter and tighter as you tighten it down. That's a good thing to have good stability right away. Keep this in mind. Sometimes if the patient happens to have too much bone loss, you need the long extension one to be able to go on the way down. Alright, now we're going to confirm. You can relax, you can close if you want. So we're going to put the healing cap on top of that first. Open it for you. Yeah. So later I have to alter this, you see the diameter of that cap a bit wider to interfere with the other one. So I will treat it. And let me try this in. Hopefully I don't have to adjust it, but we'll see. Not supposed to. If you get the first severity, it's not supposed to spin. If the implant spin, that means the bone even too soft, or the site that you put the implant in was a bit too big for the implant. If that's the case, you have to use a bigger sided implant. Let's see. There we go. We took the X-ray earlier, the two touching each other, but now it's going to each other more. Let's put focal layer in. I don't have to do anything. The only thing I mentioned to the patient that expect this, that when we do the restoration crown, the tip is going to be a little bit longer than the other one. But in the future, I was thinking we're going to try to make some pink portion around the gum, so it's not going to be so obviously too long. I think the surgery is complete, but let me double check to get a patient leaving town next week. Make sure everything tighten up, and so I will tighten up by 10 to 15 newtons to be strong enough to keep the